Welcome to Dietitian Academy, your shortcut to cracking dietitian exam. Hi everyone, I am Mohammad Shuaib, a certified dietitian with bachelor's and master's degree in nutrition and dietetics. I recently cracked AIIMS CRE Dietitian Exam with All India 4th rank in my first attempt, and now I am here to help you succeed in this RRB Dietitian Exam, which is going to be conducted in this month. On Dietitian Academy, I will be uploading 70 most predicted MCQs questions daily, focusing purely on exam relevant questions without going deep into the theory because the time is short. If you find this session helpful, I will also start topic-wise classes and provide notes for the future government dietitian exam. So subscribe now, stay consistent, and let's crack this exam together. Hello everyone, welcome to our part 6 of our discussion series. Question number 1. Which organelle plays a central role in autophagy and cellular digestion? Peroxisome, lysosome, Golgi apparatus, endoplasmic reticulum. The answer will be B. Lysosome. Lysosomes are membrane-bound vesicles that contains hydrolytic enzymes. They digest unwanted materials, cellular debris, and damaged organelles, a process called autophagy. This is essential for cellular homeostasis and turnover of cellular compounds. Defects in lysosomal functions can lead to storage disease like Tay-Sachs disease. Question number 2. Which hormone acts as an antagonist to insulin by increasing blood glucose level during stress? Cortisol, epinephrine, glucagon, all of the above. The answer will be D. All of the above. Glucagon increases blood glucose by stimulating glucogenolysis and gluconeogenesis. Epinephrine stimulates glycogen breakdown and inhibits insulin action during stress. Cortisol increases hepatic gluconeogenesis and decreases glucose uptake by cell. Together, they ensure the body has enough glucose during stress or fasting. Question number 3. Surfactant in the lungs is secreted by type 1 pneumocytes, type 2 pneumocytes, alveolar macrophages, ciliated epithelial cells. The answer will be B. Type 2 pneumocyte. Type 2 alveolar cells produce surfactants, a phospholipid-rich fluid that reduces surface tension in alveoli. This prevents alveolar collapse during exhalation and is critical for lung compliance. Deficiency of surfactants in preterm infants leads to respiratory distress syndrome. These cells also generate type 1 cells after injury. Question number 4. Which type of epithelial tissue is specialized for diffusion and is found in alveoli? Simple cuboidal, simple cuboidal, stratified squamous, simple squamous, transitional. The answer will be C. Simple squamous. Simple squamous epithelium consists of flat, thin cells ideal for gas exchange. It lines the alveoli of the lungs, enabling oxygen and carbon dioxide to diffuse easily. It is also lines blood vessels, endothelium, and blood cavities. The minimal thickness facilitates rapid diffusion across membrane. Question number 5. Which mineral is required for activation of insulin receptor tyrosine kinase? Zinc, magnesium, chromium, copper. The answer will be C. Chromium. Chromium is a trace mineral involved in carbohydrate metabolism. It enhances insulin sensitivity by activating insulin receptor kinase activity. This improves glucose uptake by the cell and helps in blood glucose regulation. Chromium deficiency may contribute to insulin resistance in some cases. Question number 6. Which vitamin functions as a coenzyme in transamination reaction? Vitamin B6, vitamin B12, vitamin C, vitamin E. The answer will be A. Vitamin B6. Vitamin B6, also called as pyridoxal phosphate, which is a PLP, is a coenzyme for many amino acid reactions. It plays a central role in transamination where amino groups are transferred between molecules. These reactions are crucial for amino acid metabolism and neurotransmitter synthesis. Deficiency can lead to irritability, anemia, and peripheral neuropathy. Question number 7. The most efficient storage form of energy in the human body is muscle glycogen, liver glycogen, adipose tissue, triglycerides, circulating glucose. The answer will be C. Adipose tissue, triglycerides. 1 gram of fat gives 9 kilocalories, making it energy-dense macronutrient. Triglycerides in adipose tissue are stored long-term and metabolized during fasting or starvation. Compared to glycogen, fat stores are most abundant and efficient. Glycogen provides quick energy, but fat is the body's primary energy reserves. Question number 8. Selenium functions primarily as cofactor for which enzyme? Catalase, glutathione peroxidase, cytochrome P450, NADPH oxidase. The answer will be B. Glutathione peroxidase. Glutathione peroxidase reduces hydrogen peroxide and lipid peroxidase, protecting cells from oxidative damage. Selenium is essential for its catalytic functions, antioxidant defense. Low selenium levels can impair immune function and thyroid hormone metabolism. It also helps prevent cell membrane damage and supports fertility. Question number 9. The protein requirement increases by how much during lactation? 10 grams, 15 grams, 25 grams, 35 grams. The answer is C, 25 grams. Lactating women needs additional protein to support milk synthesis and infant growth. ICMR recommends an extra 25 grams per day of protein during early lactation. Protein supports hormonal functions, tissue repair, and immune transfer via breast milk. Insufficient milk can affect milk quality and maternal health. Question number 10. For Indian adults, the RD of calcium as per ICMR 2020 is 800 mg per day, 1000 mg per day, 1200 mg per day, 600 mg per day. The answer will be B, 1000 mg per day. Calcium is essential for bone health and muscle contraction and blood clotting. The ICMR increased the RDA to 1000 mg per day for adults to prevent osteoporosis and deficiency. This is particularly important for women as bone mass declines post-menopause. Dietary sources include milk, curd, leafy greens, and fortified foods. Question number 11. Which of the following is not included in MyPlate dietary model? Fruits, dairy, oils, protein. The answer will be C, oils. The USDA, United States Drug Administration, MyPlate includes 5 food groups: fruits, vegetables, grains, protein, and dairy. Oils are important for health but not one of the main food group in the model. They are included in dietary guidelines but shown separately in recommendations. Healthy oils includes olive oil and canola oil, rich in unsaturated fats. Question number 12. PDCAAS score of 1 is observed in which of the following proteins? Wheat, egg, soya, both B and C. The answer will be D, both B and C. PDCAAS protein digestibility corrected amino acid score evaluates protein quality. Eggs and soya protein has the highest score of 1, indicating complete essential amino acids and high digestibility. These are ideal protein source for both vegetarian and non-vegetarian. Wheat protein scores lower due to limited amino acids and digestibility. As I also explained this type of question in my past videos, where if the one is called a good PDAS score, which has highest protein availability. If the score is less than 1, then we call it as partially complete amino acid score. So soya has around 0.95 of PDAS score and egg has 1 as PDAS score. Question number 13. Which amino acid is exclusively ketogenic? Leucine, valine, methionine, threonine. The answer will be A, leucine. Leucine is a branched amino acids, BCAAs, that cannot be converted to glucose. It is metabolized into ketone bodies, making it exclusively ketogenic. This property is crucial during fasting when the brain uses ketones for energy. Unlike other amino acids, it bypasses gluconeogenesis pathway. Question number 14. The term first phase metabolism refers to kidney clearance, liver inactivation of orally ingested nutrients, brain uptake, muscle degeneration. The answer will be B, liver inactivation of orally ingested nutrients. First phase metabolism occurs when substances are absorbed from the gut and metabolized in the liver before reaching systematic circulation. It reduces the bioavailability of nutrients and drugs taken orally. This is why some medications are given sublingually or via injections. Nutrients like folate also undergoes first phase metabolism. Question number 15. Which macronutrient has the highest thermic effect? Fats, carbohydrates, proteins, alcohol. The answer will be C, proteins. The thermic effect of food is the energy used in digestion, absorption, and metabolism. Protein has the highest thermic effect of around 20 to 30% compared to carbs, which contains 5 to 10%, and fat contains 0 to 3%. This makes high protein diet useful in weight management. It also supports satiety and lean muscle preservation. Question number 16. Which dietary factors most significantly affects iron absorption? Phytates, fiber, calcium, all of the above. Here the answer will be D, all of the above. Phytates in cereals, calcium and fibers all reduce non-heme iron absorption in the gut. Vitamin C enhances absorption, but these inhibitors compete or bind iron. Diets high in inhibitors can cause iron deficiency even with adequate intake. Strategies like soaking, fermenting, or adding citrus helps improve bioavailability. Question number 17. The active anti-inflammatory compound in ginger is gingerol, quercetin, lutein, allicin. The answer will be A, gingerol. Gingerol gives ginger its pungent flavor and has anti-inflammatory and antioxidant properties. It helps reduce nausea, muscle pain, and inflammation in arthritis. It is often used in functional foods and nutraceuticals formulas. Its action is similar to NSAIDs, non-steroid anti-inflammatory drugs, in reducing prostaglandin synthesis. Question number 18. Phytosterols are most beneficial in managing Diabetes, hypertension, hypercholesterolemia, obesity. The answer will be C. Hypercholesterolemia. Phytosterol structurally resembles cholesterol and compete with its absorption in the gut. These reduces total LDL cholesterols, supporting cardiovascular health. They are found in nuts, seeds, and fortified cereals. Daily intake of 2 grams phytosterols can significantly lower LDL levels. Question number 19. Coenzyme Q10 supplementation is useful in which condition? Hyperthyroidism, congestive heart failure, asthma, anemia. The answer will be B. Congestive heart failure. Coenzyme Q10 plays a critical role in mitochondrial energy production, ATP synthesis. Its levels are reduced in cardiac disease and by statins. Supplementations improves cardiac output and energy in heart failure patient. It also acts as an antioxidant, protecting cells from oxidative damage. Statins is nothing but a drug which helps in decreasing the cholesterol in the body. Question number 20. Which compound in green tea is linked to weight loss effect? Catechins, saponins, tannins, isoflavones. The answer will be A. Catechins. Catechins, especially EGCG, increases fat oxidation and thermogenesis. EGCG is epigalactocatechins. They also exhibit anti-inflammatory, anti-carcinogenic and glucose lowering effects. Green tea is widely used in weight management regime and metabolic syndromes. Caffeine may enhance their fat burning effect synergistically. Question number 21. In PCOS, dietary guidelines emphasize reducing saturated fats, glycemic load, omega-3 intake, fiber. The answer will be glycemic load. In PCOS, associated with insulin resistance, making low glycemic index diet beneficial. Reducing simple sugars and refined carbohydrates improves insulin sensitivity and hormone balance. Such diet helps regulate menstrual cycles and manage weight. Whole grain vegetables and lean proteins are encouraged. Question number 22. A gluten-free diet is deficient in fiber, vitamin D, iron, all of the above. The answer will be D. All of the above. Gluten-free diet often lacks fiber due to refined flour, iron and vitamin D due to limited fortified foods. Careful planning is needed to ensure nutritional adequacy. Whole gluten-free grains like quinoa, amaranth and fortified products should be included. Supplementations may be necessary if deficiency occurs. Question number 23. In hepatic encephalopathy, which amino acid is restricted? BCAAs, branched amino acids, AAAs, aromatic amino acids, essential amino acids, sulfur containing amino acids. The answer will be B. Aromatic amino acids. Aromatic amino acids like tyrosine, phenylalanine, tryptophan accumulates due to impaired liver metabolism. This leads to altered neurotransmitter balance and worsened brain functions. Branched amino acids are preferred for nutrition in liver diseases. BCAA supplements improves nitrogen balance and neurological symptoms. Question number 24. Which formula is appropriate for renal patients in tube feeding? High sodium, low potassium and phosphorus, low protein, low fiber. The answer will be low potassium and phosphorus. Renal patients often have impaired excretion of potassium and phosphorus, risking hyperkalemia and hyperphosphatemia. Specialized renal feeds are formulated with reduced potassium and phosphorus content. Protein may be restricted or adjusted based on dialysis status. Sodium and fluid levels may also be needed monitoring. Question number 25. Which lab marker reflects visceral protein status? Albumin, hemoglobin, creatinine, sodium. The answer will be A. Albumin. Albumin is a long-term indicator for protein status and inflammation. Low levels may suggest malnutrition, liver diseases, or infection. However, it's affected by fluid status and not ideal for acute changes. Prealbumin is the most sensitive short-term marker. Question number 26. Nitrogen balance is calculated using serum urea levels, dietary protein intake and urinary nitrogen output, weight loss trends, BMI values. The answer will be B. Dietary protein intake and urinary nitrogen output. It helps assess whether the body is gaining, losing or maintaining lean tissues. Positive balance is seen in growth, recovery and pregnancy. Negative balance indicates catabolism, infection or underfeeding. Gavaskar is characterized by muscle wasting with edema, severe calorie deficiency without edema, high fat intake, vitamin A toxicity. The answer will be A. Muscle wasting and edema. Edema is the characteristic feature of Gavaskar. So whenever you find the edema with muscle wasting, then the Gavaskar is the main reason. It is form of protein energy malnutrition with sufficient calories but inadequate protein. Low serum albumin causes edema, skin changes and fatty liver. Unlike marasmus, which causes severely wasting, which is the reason of low calorie intake. Kavashka shows a swollen appearance. It is often seen in children in low-income settings. Question number 28. In ICU patients, energy requirements are best calculated using Harris-Benedict's equation, Mifflin-St. John equation, indirect calorimetry, BMI chart. The answer will be C. Indirect calorimetry. Indirect calorimetry measures oxygen consumption and CO2 production to estimate energy needs. It is most accurate than predictive equation in critical ill patients. Equations like Harris-Benedict's may over or underestimate in such cases. It ensures appropriate feeding and avoid overfeeding complications. Question number 29. Which bacteria are indicated of fecal contamination in water? Clostridium, E. coli, Listeria, Staphylococcus. The answer will be B. E. coli. E. coli is a coliform bacteria naturally found in the intestine of the humans and animals. Its presence in water indicates contaminated by fecal matter, which may carry pathogens. Routine water safe testing includes detection of E. coli for public health protection. It is also a key organism in testing food and milk safety. Question number 30. Which microbial toxin is stable and causes vomiting within hours? Staphylococcus enterotoxin, Salmonella toxin, botulism toxin, aflatoxin. The answer is A. Staphylococcus enterotoxin. Staph aureus produce enterotoxins that are heat stable, resistant to normal cooking. These toxins can cause rapid onset vomiting, nausea and cramps within 1 to 6 hours. Common sources includes contaminated dairy, meat and bakery items. Proper food hygiene is essential to prevent such contamination. Question number 31. Campylobacter jejuni is typically found in unpasteurized milk, canned foods, fresh products, tap waters. The answer is A. Unpasteurized milk. Campylobacter jejuni is a leading cause of bacterial gastroenteritis worldwide. It is commonly transmitted through undercooked poultry, unpasteurized milk and contaminated water. Symptoms include diarrhea, often bloody diarrhea, fever and abdominal cramps. Pasteurization and through cooking effectively kills the bacteria. Question number 32. The log phase in bacterial growth curves presents spore formation, rapid multiplications, stationary phase, decline. The answer is B. Rapid multiplication. The log phase is a period of fastest bacterial growth, cell division at a constant rate, making this phase ideal for studying antibiotic effect. It is preceded by the lag phase and followed by the stationary phase. Nutrients are abundant and during this phase supporting active metabolism. Here the first phase will be lag phase, then the log phase, then the stationary phase, then the death phase. Here the bacteria is contaminated. In the log phase it is multiplied. In the stationary phase it stays there. There is a death phase where the bacteria dies. Question number 33. Cachexia is commonly associated with increased fat storage, inflammation and muscle loss, water retention, protein overconsumption. The answer is B. Inflammation and muscle loss. Cachexia is a complex metabolic syndrome seen in chronic illness like cancer and AIDS. It leads to weight loss, muscle wasting and reduced quality of life. It is driven by inflammatory cytokines, not simply undernutrition. Nutrition therapy alone is often insufficient. Anti-inflammatory treatment are also needed. Question number 34. The DASH diet is recommended sodium intake to be less than 1500 mg per day, less than 2500 mg per day, greater than 3000 mg per day, unlimited. The answer will be A. Less than 1500 mg per day. DASH stands for dietary approach to stop hypertension. This emphasizes fruits, vegetables, low fat dairy and reduces sodium less than 1500 mg per day. Sodium retention is effective in lowering blood pressure and cardiovascular risk. High potassium and magnesium intake is also encouraged in the diet. Question number 35. In COPD, a high fat, low carb diet is recommended because fat is more filling, carb produce more CO2, protein is not needed, oxygen uptake increases. The answer will be carbohydrates produce more carbon dioxide. In COPD, breathing effort is increased and carbon dioxide removal becomes inefficient. Carbohydrate generates more carbon dioxide per kilocalorie than fat during metabolism. Thus, reducing carbs levels decreases the CO2 production, easing the respiratory load. This dietary strategy is part of pulmonary nutrition support. Question number 36. Which antioxidant supports lung function in smokers? Vitamin A, vitamin C, vitamin D, beta carotene. The answer will be B. Vitamin C. Vitamin C is a powerful water-soluble antioxidant that combats oxidative stress from smoking. It improves lung function, immune defense, and regeneration of vitamin E. Smokers require higher intake due to increased oxidative load. Citrus fruits like berries and bell peppers are good source of vitamin C. Question number 37. The coenzyme form of niacin is NAD plus NADP plus FAD, FMN, PLP. The answer will be A. NAD plus or NADP. Niacin vitamin B3 forms NAD plus and NADP plus, which acts as electron carrier in metabolism. They are essential in glycolysis, the Krebs cycles, and fatty acid synthesis. Deficiency leads to pellagra, characterized by 3 Ds. Always remember, if the question asks which deficiency causes pellagra, then it is niacin B3. And if they ask what is the 3 Ds due to deficiency of niacin, then it is dermatitis, diarrhea, and dementia. Question number 38. Urea cycle occurs in which two cellular components? Mitochondria and cytosol, cytosol and Golgi, endoplasmic reticulum and nucleus, nucleus and mitochondria. The answer will be A. Mitochondria and cytosol. The urea cycle detoxifies ammonia by converting it to urea in the liver. The first step occurs in mitochondria and later one in the cytosol. This separation allows for regulation and transport of intermediates. Defects in this cycle causes hyperammonemia and metabolic disorders. Question number 39. The transamination reaction requires which vitamin-derived coenzyme? Biotin, thiamine, pyridoxal phosphate, kinocobalamin. The answer will be C. Pyridoxal phosphate. This question is already repeated in the initial video, where they have asked about B6. So vitamin B6 is nothing but pyridoxal phosphate. PLP acts as a coenzyme in transamination, key for amino acid metabolism. It facilitates the transfer of amino groups between amino acids and keto acids. This is crucial for nitrogen balance and synthesis of non-essential amino acids. Deficiency impairs protein metabolism and causes neurological symptoms. Question number 40. Ketone bodies are synthesized in adipose tissue, liver, mitochondria, kidney, cortex, pancreas. The answer will be B. Liver, mitochondria. During fasting or carbohydrate restriction, the liver converts fatty acids into ketone bodies. This occurs in mitochondrial matrix and includes acetoacetate and beta-hydroxybutyrate. Ketones serves as an alternative energy source for brain and muscle. They cannot be used by the liver itself due to lack of specific enzymes. Question number 41. In a study, randomization helps to ensure blinding, minimize confounding, reduce data collection time, improve significance. The answer will be B. Minimize confounding. Randomization ensures that known and unknown confounding variables are evenly distributed. This improves the internal validity of clinical trials. It helps ensure that difference in outcome are due to the intervention. It is a fundamental step in randomized control trial. Question number 42. Which statistical test is used to assess association between two categorical variables? T-test, chi-square test, ANOVA, Fission's correlation. The answer will be B. Chi-square test. Chi-square test determines whether there is a significant association between two categorical variables. It compares observed versus expected frequencies in a continuous table. It's widely used in public health and nutrition research for analyzing survey data, for example, assessing association between gender and dietary preferences. Question number 46. If the confidence interval of an odds ratio includes 1, the result is statistical significance, non-significance, negative correlation, unethical. The answer will be B. Non-significant. An odd ratio of confidence interval that includes 1 suggests no difference or effect between groups. This implies that the result is statistically non-significant at the given confidence level. It means the exposure may not be associated with outcome. Statistically, significance usually requires the entire confidence interval to be observed or below 1. Question number 44. In nutrition survey, FFQ stands for food formula questionnaire, food frequency questionnaire, fast food quiz, fiber, fat, creatines. The answer will be food frequency questionnaires. FFQ collects data on how often specific food items are consumed over a given period. It is a common method in epidemiology studies to assess dietary patterns. It is easy to administrate and useful for large population. However, it relies on memory and may not capture portion size accurately. Question number 45. The protein requirement of a patient with stage 5 kidney disease on dialysis is 0.6 gram per day, 1.2 gram per day, 0.4 gram per day, 2 gram per day. The answer will be B. 1.2 grams per kg per day. Dialysis removes nitrogenous waste and some amino acids, increasing protein needs. Patients on hemodialysis requires around 1.2 gram per kg per day to prevent muscle wasting. In contrast, pre-dialysis CKD patients may need protein restrictions. Adequate energy intake is also essential to prevent catabolism. Question number 46. In a severely underweight child with spam, refeeding scene should begin with F75 formulas, high protein feeds, TPN, breastfeeding only. The answer will be A. F75 formulas. F75 is the initial therapeutic feed for SAM with low protein and low sodium. It helps stabilize metabolism before progressing to the higher energy F100 or catch-up feeds. Sudden high calorie feeding can cause refeeding syndrome and complications. Monitoring for electrolyte shifts is essential during the treatment. Question number 47. Hyperkalemia in renal patients can be managed by restricting apples, bananas, white rice, chicken. The answer will be B. Bananas. Bananas are rich in potassium, dangerous for CKD patients who cannot excrete excess potassium. Hyperkalemia can lead to cardiac arrhythmia and even death. Other high potassium foods includes oranges, tomatoes and potatoes. Education on low potassium diet is vital for renal dietary management. Question number 48. In refeeding syndrome, the first electrolyte to drop is usually potassium, phosphate, sodium, magnesium. The answer will be B. Phosphate. During refeeding, insulin stimulates cellular uptake of phosphate for ATP synthesis. This causes rapid hypophosphatemia, leading to cardiac and neurological complications. Thiamine and potassium also shifts intercellularly. Hence, slow introduction of calories with close monitoring is essential. Question number 49. Which hormone stimulates gluconeogenesis? Insulin, glucagon, thyroxine, leptin. The answer will be Glucagon. Glucagon is secreted during fasting to increase blood glucose levels. It activates hepatic gluconeogenesis and glycogenolysis. Insulin opposes this by promoting glucose uptake and storage. Thyroxine and cortisol are also influence gluconeogenesis but less adequately. Leptin is a hunger suppressing hormone. Question number 50. In prolonged fasting, primary fuel for brain becomes glucose, fatty acids, ketone bodies, amino acids. The answer will be C. Ketone bodies. Initially, the brain uses glucose by 2 to 3 days of fasting. Ketones become the main fuel. This adaptation spares muscle breakdown and protein loss. The liver produces ketones from fatty acids during starvation. This is a survival mechanism to support brain function without glucose. Question number 51. Which enzyme is deficient in phenylketonuria? Tyrosine hydroxylase, phenylalanine hydroxylase, homogeneity oxidase, galactose 1-phosphate uridyl transferase. The answer will be phenylalanine hydroxylase. PKU is a genetic disorder caused by deficiency of phenylalanine hydroxylase. This enzyme converts phenylalanine to tyrosine. Its absence leads to phenylalanine buildup. Toxic levels affect brain development, causing intellectual disability if untreated. Early diagnosis via newborn screening and a low phenylalanine diet is critical. Question number 52. Elevated HbA1c levels indicates recent high protein intake, long-term poor glycemic control, hyperthyroidism, hypoglycemia. The answer will be B. Long-term poor glycemic control. HbA1c reflects average blood glucose levels over 2 to 3 months by measuring glycosate, hemoglobin and HbA1c greater than 6.5% diagnosis of diabetes and values greater than 7% shows poor control. Maintaining HbA1c less than 7 is the standard diabetic goals. Question number 53. The ICDS scheme in India caters primarily to adult diabetics, children under 6 and pregnant women, elderly, farmers. The answer will be children under 6 years and pregnant women. Integrated Child Development Services (ICDS) provides nutrition and education and health care to vulnerable groups. Beneficiaries includes children under 6 years old and pregnant women and lactating women. It includes supplementary nutrition, preschool education, immunization and health checkups. It operates through Anganwadi centers across the India. Question number 54. Weekly iron and folic acid supplementation program targets adolescent boy, adolescent girls, only infants, post-menopausal women. This question I have already discussed it in my past videos. Here the answer will be adolescents girls. Weekly iron and folic acid supplementation aims to reduce iron deficiency anemia in adolescents, especially girls aged 10 to 19 years. They receive weekly iron 100 mg and folic acid 500 mcg tablets. These addresses anemia and prepare girls for healthier pregnancies later. The program also includes screening and deworming. Question number 55. Double burden of malnutrition refers to deficiency of 2 micronutrients, coexistence of undernutrition and obesity, malnutrition and infection, vitamin A and D deficiency. The answer will be B. Coexistence of undernutrition and obesity. This question is also discussed in my past videos. The term describes population facing both undernutrition and overnutrition. It often occurs in low and middle income countries undergoing rapid nutrition transition. Children may be underweight while adults in the same household are overweight. This burden increases healthcare and economical costs. Question number 56. Poshan Abhiyan aims to reduce stunting to 20%, 25% 25%, 30%, 15%. The answer will be D, 15%. Poshan Abhiyan, called Prime Minister's overarching scheme for holistic nutrition. Abhiyan in the India's flagship nutrition mission. Its goal is to reduce stunting to 15% by 2025, along with reducing underweight and anemia. It uses technology in intersectoral convergence and community participants. The 1000-day window from consumptions to 2 years is emphasized. Question number 57. Which nutrients absorption declines with age due to reduced gastric acid? Iron, calcium, vitamin B12, vitamin C. The answer will be vitamin B12. Vitamin B12 requires intrinsic factors and acidic pH for release from food proteins. Older adults often have atrophic gastritis or uses antioxidant, reducing acid, etc. These leads to decreased B12 deficiency and risk of deficiencies. Symptoms include anemia, fatigue, and neurological problems. Question number 58. Complementary feeding should begin at 4 months, 6 months, 8 months, 12 months. The answer will be B, 6 months. At 6 months, breast milk alone no longer meets an infant's nutritional needs. Complementary feeding includes soft food while continuing breastfeeding. It helps prevent malnutrition and supports growth, and introduce taste variety. Delayed or early introduction can increases the allergy or infection risk. Question number 59. A child with vitamin A deficiency is at risk of rickets, xerophthalmia, scurvy, pellagra. The answer will be B, xerophthalmia. Vitamin A maintains vision, immune function, and epithelial health. Its deficiency causes night blindness and xerophthalmia, a spectrum of eye disorders. This can progress to corneal ulcers and blindness if untreated. Vitamin A supplements and diet, green leafy vegetables, liver are key preventive measures. Question number 60. Which nutrient helps in delaying sarcopenia in elderly? Fiber, protein, iron, potassium. The answer will be B, protein. Sarcopenia is a age-related loss of muscle mass and strength. Adequate protein intake 1 gram to 1.2 gram per kg per body weight slows muscle degeneration and supports synthesis. Combined with resistance exercises, protein preserves functionality and dependence. Leucine-rich protein, example whey, are especially beneficial. Question number 61. Oral immunotherapy OIT is used in Crohn's disease, type 1 diabetes, food allergy desensitization, GERD. The answer will be C, food allergy desensitization. OIT involves giving small increases doses of allergic food under medical supervision. It aims to build tolerance and reduce risk of severe allergic reactions. It is especially studied in peanut allergy management. OIT is not a cure but improves quality of life and safety. Question number 62. In lactose intolerance, diagnostic test of choice is endoscopy, skin prick test, hydrogen breath test, IgE assay. The answer will be C, hydrogen breath test. In lactose intolerance, undigested lactose is fermented by colonic bacteria. This produces hydrogen which is absorbed into the blood and exhaled. The hydrogen breath test detects hydrogen ions after lactose intolerance. It is non-invasive and commonly used for diagnosis. Question number 63. Gluten sensitivity differs from celiac disease in that there is no autoimmune component. It affects the lungs. It causes anemia. It involves a genetic mutation. The answer will be A. There is no autoimmune component. Non-celiac disease sensitivity causes symptoms like bloating, fatigue, when gluten is consumed. However, it lacks autoimmune atrophy seen in celiac diseases. There are no specific antibodies or biopsy finding in the gluten sensitivity. Diagnosis is clinical and exclusion based. Question number 64. The big 8 allergen includes all except milk, soya, wheat and corn. The answer will be D, corn. The big 8 allergens are milk, egg, fish, shellfish, peanuts, tree nuts, soya and wheat. These account for most food allergens in children and adults. Corn is less common allergen and not part of the standard groups. Labeling laws in many countries require declaring big 8 allergens. Question number 65. A patient with uncontrolled type 2 diabetes and stage 3 CKD should avoid brown rice, bananas, olive oils, lentils. The answer will be bananas. Bananas are high in both potassium and sugar, making them unsuitable for diabetic CKD patients. Excess potassium in CKD can lead to arrhythmia and sugar spikes blood to glucose. Safer alternative includes berries or apples in the moderation. Due to diet must be tailored to manage both conditions. Question number 63. For a burn patient, which nutrient is most important to monitor? Protein, fiber, vitamin C, water. The answer will be A, protein. Burn injuries dramatically increases protein requirement for tissue repair and immune function. Protein loss loss occurs and muscle catabolism through muscle catabolism. Without sufficient protein, wound healing delays and infection risk rises. Enteral nutrition with high protein formulas is often used. Question number 67. A marathon runner collapses post-race. Which nutrient is most critical to assess? Magnesium, glucose, calcium, zinc. The answer will be B. Glucose. Prolonged intensive activity depletes glycogen and lower blood sugar. Hypoglycemia can cause fatigue, confusion, or collapse in endurance athletes. Rapid carbohydrate replacement is critical post-exercise. Sports drinks, gels, or glucose tablets are commonly used. Question number 68. In pregnancy, induced hypertension restricts sodium, potassium, fiber, protein. The answer will be A. Sodium. Excess sodium worsen water retention, elevate blood pressure. Reducing sodium intake helps manage pregnancy-induced hypertension or pre-eclampsia. The DASH diet principles are often adapted in such cases. Monitoring weight gain and edema is also important. Question number 69. A vegan is at greatest risk of deficiency in vitamin A, vitamin B12, vitamin C, folic acid. The answer will be B. Vitamin B12. B12 is found almost exclusively in animal-based products like meat, eggs, dairy. Vegan must rely on fortified foods or supplements to meet their needs. Deficiency leads to megaloblastic anemia, fatigue, and neurological symptoms. Regular screening and supplementations are essential. Question number 70. A 70-year-old with poor dentition should be recommended soft nutrient-dense diet, raw vegetable salad, dry biscuits, high-fiber raw diet. The answer will be A. Soft nutrient-dense diet. Dental problem reduces chewing ability, leading to poor intake and weight loss. Soft food like prodigy, mashed vegetables and soups ensure nutrition and eases. They should be energy and protein dense to prevent malnutrition. Avoiding hard, dry or tough food improves compliance. That's all for today. If you like the session, give it a thumbs up and subscribe to the channel. We'll meet you in the next video. Until then, take care.